Hi guys, thank you for joining us today. We're going to start in just a minute. We've got over 25 attendees today, so we're going to give everyone a chance to sign on. Giving everyone just a minute to get their audio hooked up and to sign in. So it's 10 on the hour, and I really appreciate you guys being on time. Since this is online, we're going to give everyone just a minute or two in case they have any technical difficulties. We'll start by 10:05. Get you out of here on time by 11. If you're just joining us or you're just getting your audio connected, and we're just giving other attendees just a few more minutes to clock in, we will start momentarily. I'm just going to give it one more minute here and we'll get started on the presentation. We do have a few more people trickling in, so just giving everyone a chance to sign on. Okay, all, thank you very much for your patience. Welcome to our Medicare 101 presentation. I have the honor of introducing Elizabeth Sharia. She is going to start off for you. Elizabeth, how are you doing today?
I'm good, Sarah. Thank you so much. Thank you, everybody, for joining us today. Like Sarah said, we're gonna move right along. Hopefully, get you out of here before 11. We're really gonna try to scoot through this, but still take the time to get you all the information that you need. So today we're going to be starting with solving the Medicare puzzle. And I will add real quick, if at any time you cannot hear or you're having difficulty seeing the slides, try logging out and logging back in and see if that fixes it. If that's still, if you're still having trouble, you still can't see or hear, shoot a message to the staff and we will try to help troubleshoot that. Okay, so we're just going to go ahead and get started here. Another thing real quick that I do want to mention, you have the option to ask a question. Even though everybody is silent, you can type a question to myself or Sarah, and we will do our best to answer it while we're on this. And I do want to also say, there's two different options to send a message. You can send a private message, or you can send a message to all. We do ask that if you have any questions that pertain to your personal information, any health-related questions, we do ask that you please either send that a private message, or that you speak to us afterwards and we can answer those questions. We really don't want your personal information going out to everybody. So probably the first question that I get asked most of pretty much every single appointment that I do is, why is AAA doing this? What's the point? What's the purpose? Well, AAA as a member organization is really, really focused on making sure that our members receive every available benefit that we can possibly think of. And so the Medicare division was created within AAA to help everybody understand the pitfalls and the obstacles that would come along with signing up for Medicare. Many people are very overwhelmed by the information that they are receiving on a daily basis. You know, the closer that you get to your 65th birthday, the more inundated you get with information, people telling you, you've got to do this, you've got to do that, you've got to buy this plan, you've got to buy that plan. And AAA is really here to make sure that you understand how Medicare applies to your situation, because everybody is going to have a different situation going into Medicare, and not everybody is going to fall under the same categories. So what I always say is, you don't really need to understand every single rule with Medicare. You need to understand how it applies to you and what it's going to mean for you in the future. Now, we have, if in case no one has really noticed, we have been in a bit of a difficult situation with the pandemic for the past, it's been almost a year now. And when the lockdown happened and everybody was sent home, you know, we kind of stumbled a little bit trying to figure out how we could still give our members the information that they need, and also remain safe, remain healthy, and not put anybody at risk, you know, staff or members. And so we created this webinar series so that you can get the information that you need, you can get some questions answered. And we have dedicated phone numbers for our members to call for questions and appointments. We record everything for accuracy and compliance. We also have video conferencing available, so you can actually see my screen, see what I'm looking at for you. We have digital signatures, and everything is documented and emailed to you immediately following every single appointment. And at this point in the presentation, I'm going to start asking if anybody has questions, and if nobody has anything, we're going to go ahead and move on.
I don't have anything for you, Elizabeth.
Okay, so we're just going to go ahead and move on. Okay, so as I said, we're here to help you avoid any potholes. So what are the potholes? What are the obstacles that could come up? Well, you are always going to find issues with enrollment periods. Well, not always. I should backtrack a little bit on that. It's not always going to be an issue, but you need to understand what enrollment periods you have, what options you have around those enrollment periods. You're going to need to understand what the penalties are going to be if you don't get everything set up the first time or the right way. Every single carrier is going to have a slightly different physician network and a drug formulary. And the question comes up constantly, what's a drug formulary? And we're going to get into that in a lot of detail later on, but basically every carrier has a different list of drugs that they cover, and they have a list of drugs that they do not cover. So you need to understand if your prescription is going to be covered by the carrier that you like. You know, just because your neighbor tells you, oh, I'm on XYZ plan with ABC carrier and it's the best, that's the one that you need to go on. Well, maybe it is the best for them. Maybe it is the best option for them. But then when you start looking into it, guess what? Your prescription medication is not going to be covered. So you'll be paying out of pocket for that. And the doctor that you've been going to for the past 20 years, who knows you, knows your situation, knows your health, doesn't accept that plan. So you need to understand those obstacles and how you can work through that and find what's going to work for you. There's also the difference between Medicare Advantage and Medicare supplement plans, because they are very, very different, and most people do not understand that they are very different. And people tend to use those terms interchangeably, and they are not interchangeable. And I don't see any questions about that, so we're going to go ahead and move on. Okay, the first obstacle is enrollment periods. Okay, so normally if we were face to face, I would ask for a show of hands, everybody who is going to be turning 65 this year. Since I cannot do that, and since this is a Medicare 101 webinar, I'm going to go ahead and assume that if you're on this webinar, you are turning 65 or you are going into Medicare for the first time. So that means that you're in your initial enrollment period. So what's your initial enrollment period? That's going to be a 7-month window around the month of your birth. The day of the month does not matter as long as you were not born on the first of the month. Okay, if your birthday falls on the first, move all of the information, move all of the dates back 1 month, and you've got the right information. So basically, if you were born April 15th, guess what? Your effective date for everything, if you sign up for Medicare right away, is going to be April 1st. But if you were born on April 1st, your effective date for everything is going to be March 1st. It's a little bit confusing, but basically, if you weren't born on the 1st, you can kind of just assume that your effective is going to be the 1st of the month. So keeping with my example of somebody born April 15th, tax day, if you were born April 15th, you are in your initial enrollment period, because it starts 3 months prior to the month of your birth. It includes the month of your birth, and then it extends 3 months after. So what does that mean? That means that during that 7-month window, it's open. It is you're the best time to get everything set up the correct way. And what that means is, if you are not going to continue to work, okay, you're going to be retiring, and you don't have a state or federal insurance pension plan, then you need to sign up for Part B. Because if you don't sign up for Part B during that time, then the next opportunity, keeping with my example of April 15th, if somebody was born April 15th and does not take care of Medicare Part B, the next opportunity that they are going to have to sign up for Medicare Part B and pick a plan is going to be during the next enrollment period, which is the annual enrollment period. And it happens annually from October 15th through December 7th. Okay? Now, during that time period, you can go into Part B for the first time, but guess what? Your effective date is not going to be until January 1st of the following year. And now, not only do you not have an insurance plan for all of that time, now you've accrued the penalty. And now you are going to pay a higher Part B premium than other people because you didn't take care of it in time. Okay? So the annual enrollment period is where you can make changes. Okay, that's going to be the time frame when, if you signed up for a Medicare Advantage plan in April when you first were eligible, and I'm sorry, Margaret, I'm saying Part B as in boy. Okay, we'll get into Part D, which is prescription drugs, later, but Part B is the big one. That's your medical insurance, and I'll explain that in just a moment. Right now, we're just worrying about the enrollment periods, and then we'll get into what each one of those portions mean, because each portion is a little bit different. So the annual enrollment period from October 15th through December 7th, that is the time when you can make changes to your Medicare plan. Okay, So if the plan that you chose during your initial enrollment period when you first started in April is now no longer going to cover the things that you want, or if there's a new plan that comes out and you decide that that plan is going to be better suited for your needs, you can make that change during the annual enrollment period. And I should say that during the annual enrollment period, all of the plans are going to change a little bit. Some are going to change a lot of it. Some are going to be discontinued entirely. So it's all going to change during that time. It's not absolutely mandatory or necessary that your plan changes, but most of them do. So you do need to take that opportunity to review what you have and make sure that it is still going to cover you the way that you need it to. And just to give you a little for instance, this year, one of the carriers set an out-of-pocket maximum on their inpatient hospital stay. What does that mean? That means that once you've paid so many dollars in copay for an inpatient hospital stay, you don't have to pay anymore. So if you're hospitalized multiple times a year, which considering the COVID situation could be something that somebody faces, you could be in perfect health, catch COVID, and now you're hospitalized for an extended period of time, or you're hospitalized multiple times. The inpatient hospital maximum means that you stop paying after a certain point. And then one of the carriers made a change to where they made it so that their inpatient hospital benefit is per admission. So that means every time you're admitted to the hospital, you're going to continue to pay. So those are the kind of things that you need to pay attention to when you're reviewing your plan every single year. And David, I do see that you have a question. How does Medicare, hang on one second, I gotta maximize my screen a little bit so I can read your question. I can't actually see the whole thing. So just give me one moment to review that. Okay. How does Medicare work with me if you have VA medical? Okay, good question, David. And in order to answer that properly, I'm going to want to speak to you more in depth. If you do want to speak to me afterwards or speak to Sarah after this webinar, because there's a lot that's involved in that question. But just to give you a short answer, if you have VA benefits, you don't need to sign up for a Medicare Advantage plan. You do have options, and especially if they also cover your prescription drugs. So that's a little bit more of an involved question than I can get into right now, but I do want to speak to you afterwards so we can kind of go through everything. Sorry, I can't give you the full answer right here, right now, but that is definitely a good question and definitely something I want to speak to you more closely about. So I'll reach out to you when we're done and we'll go over that. And I don't see any more questions, so let's move on to the next enrollment period, which is the Medicare Advantage open enrollment period. So that happens every year from January 1st to March 31st. So in case you haven't looked at a calendar, we are in that enrollment period right now. What does that mean? How is that different from the annual enrollment period? Well, it's different because the plans aren't changing. The plans are exactly the same as they were during the annual enrollment period, but this time frame gives people who are on a Medicare Advantage plan, and that's Medicare Advantage only, or prescription drugs, that gives those people a one-time opportunity to change their plan. So it used to be called the Medicare disenrollment period, and it was mostly for if somebody went into a Medicare Advantage plan and they decided they wanted to go back into original Medicare by itself, they could disenroll. Now it's for people who maybe are like, you know what, I'm having a little bit of buyer's remorse. I think I might have made a mistake. I want to switch to this plan. You can do so once until March 31st, okay? And also to let you know, you cannot go into Medicare for the first time during this enrollment period. So just backtracking a little bit to where I said during the initial enrollment period, our example was born April 15th. They didn't get everything set up. They decided during the annual enrollment period from October to December, you know what, I'm going to just enjoy Thanksgiving and I'm not going to worry about anything else. I'm not going to do this. Now it's January 1st and they want to go into Medicare for the first time. Guess what? You can't. So if you miss the initial enrollment period and you miss the annual enrollment period and it's now January 1st of the new year, you cannot do anything until October 15th. And then you're going to go another year without medical coverage. So it's very important to understand what applies to you, okay? And then the final enrollment period that we're going to talk about today is a special enrollment period. And that one is a little bit more of a gray area because it's triggered by specific events. If you move out of your plan area and your plan is now no longer available to you because you live in Wyoming County and the plan that you were on was only for Erie County, guess what? You have a special enrollment period. You need to switch your plan. Special enrollment periods are also triggered by life events. If you are over 65 and you've been on your spouse's plan and now your spouse is going to retire, guess what? You have a special enrollment period and now you have a time that you have to make a change and you have to do something. Okay? So always check and see if you fall into a special enrollment period and make sure that you have that opportunity and you take advantage of that opportunity when you have one. Okay? And does anybody have any questions about that one?
Talk about that poor lady who came into your office a couple months ago and what she found with her Part B deductible.
Oh, yeah. So thank you, Sarah. Thank you for bringing that up. I do want to, I don't like to tell this story only because it's probably one of the saddest situations that I've ever come across. Recently, we had a lady come into our office whose husband had just passed away. She was 87 years old, and she had been on her husband's insurance plan since forever. He was a retired state trooper, and since he passed away, she had to now find a new insurance plan because she could no longer get his. Once he retired, they said that she could remain on his plan, no problems. But here's what happened. When she went into Social Security to sign up for Medicare Part B, they informed her that her Part B premium was going to be more than $1,000 because she had a 22-year Part B penalty that had been accumulating. And when she told me this, I was floored. I was like, there's absolutely no way. You had coverage. You had your husband's plan. There's no reason that should be that high. So we did a little research, and what had happened was the moment her husband retired, even though she was allowed to stay on his plan, she needed to pick up Part B because her husband was no longer actively employed. So a few of the qualifications to postpone setting up your Part B Medicare is you need to be covered under a group plan, an employer plan. That employer plan needs to have more than 20 employees, and whoever is holding that plan, so if it's the husband, if it's the wife, whoever is sponsoring that plan has to be actively employed. So what happened was when her husband retired, she had a special enrollment period in which she needed to get her Part B set up. Because even if she wanted to remain on her husband's plan until forever, now that he was gone and she could no longer get that plan, now she couldn't get any medical insurance because she could no longer afford it. So
I know that's not your favorite story, but it's just so alarming to me because, the HR representative didn't inform them of this because, it's not their specialty. And, when you told me that story, it's heartbreaking and it's something I never want our community, to ever find themselves facing. So I appreciate.
yeah, absolutely. And you touched on a good point, is that the benefits representative didn't understand how Medicare works and what the risks are with it. And that's simply because a lot of people don't understand that there are reasons that you can postpone Medicare Part B, and then there are certain rules that exempt you from being able to do that. And always, always, always check with somebody who knows Medicare, knows Medicare specifically, because that HR representative, that benefits representative that you talk to, is really only a specialist in that group plan. And they are not going to understand every single detail of how Medicare works. And for myself and for Sarah, we hold multiple certifications. We have licenses, and we get continuing education. And every year we have to recertify in order to be able to understand what plans changed, what the new numbers are for Medicare. There's a continuing education that we have to go through that the average HR person just doesn't understand and doesn't know. So if you think you're going to fall into that category, setting up an appointment with us, it takes 5 minutes to set it up, and we can answer your questions in a few moments. Sometimes it takes a full hour, sometimes it doesn't. But it's an hour of your time to make sure that you don't pay a penalty for the rest of your life. And I don't see any questions about that, so I'm going to go ahead and move on. And we're going to get into some of the nitty-gritty nuts and bolts of Medicare here. Okay, so a little while ago, I think it was Margaret had a question about, am I saying Part B or Part D? Well, I'm kind of saying both because this is how Medicare works. Medicare Part A is your hospital insurance. That's going to cover your room and board when you're in the hospital and nothing else. It's brick and mortar. It's your bed in the hospital. Okay? Medicare Part B, that's the big one. That's the one that you have to sign up for or you get a penalty. That's the one that you have to pay for also, because Medicare Part A is considered, they call it an entitlement. I don't like calling it that because if you have been working for 10 or more years, then you've been paying your whole working life for Medicare Part A. So it's not an entitlement. You've paid for it, but now that you're 65, you don't have to pay for it. And that's only if you're a U.S. citizen and you've been working for 10 or more years, or your spouse has. Okay? If you're a new resident or you haven't been working that long, there are still options to get Medicare Part A, but you might have to pay a premium. So that's something that you'll have to take a look at. Now, Medicare Part B, like I said, is your medical insurance. That's going to pay for your doctors. That's paying for your diagnostics. That's paying for rehab treatments. That's paying for everything else. And the premium for most people this year is $148.50. And if you are on Social Security, they are going to deduct that automatically from your Social Security account or check. If you're not, they're going to bill you quarterly for that. Now, Medicare Part D is your Medicare prescription drugs. And your prescription drugs is a big topic, and Sarah's going to get into detail on that in just a few moments. But those three portions come together and form a Medicare Advantage plan or Medicare Part C. So A, B, and D equal C. Now, you would think that Medicare Part C is another portion of Social Security Medicare because it kind of makes it seem like that. But I don't really like calling it Medicare Part C because it's a little bit of a misnomer. Because Medicare Part C is a Medicare Advantage plan, which means your A, your B, and your D have been handed over to a private carrier, and that private carrier is now managing your plan. So if you have your red, white, and blue card, if you have your A and B card, and you go into a Medicare Advantage plan, guess what? You are going to take your red, white, and blue card, put it somewhere safe, keep it with your Social Security card, and you're not going to use it. You are going to use your private carrier card to, when you go to the hospital, you're going to use it when you go to the doctor, you're going to use it when you get your prescription drugs refilled, okay? And what happens is, if you have a plan that has a premium, if you have a plan that doesn't have a premium, the government is paying that private carrier to manage and coordinate your plan or your care. Okay, and that Part B premium is $148.50 for most people. Okay, there are, if you make, depending on if you're married or single, if you make less than $18,000 per year, you will either pay less or pay nothing for Part B. And then depending on if you're married or single, if you make more than $86,000 or $176,000 per year, you'd pay more. If you're somewhere in the middle, it's $148.50. And I don't see any questions about that, so we're going to go ahead and move on. No, Diane, that $148 premium is a monthly amount. And if you are on Social Security, they're going to deduct that from your Social Security check every month. If you are not on Social Security, they're going to send you a quarterly bill. So it's going to be a little bit more than $500 every quarter. Okay? So let's go ahead and move on because we're going to try to get you, okay, Lori has a question. Is Part C optional and does it have a more cost? Part C is optional. Like I said, Part C is a private carrier plan. And Sarah is going to go in a lot of detail about why most people go into a Medicare Advantage plan. And the cost is dependent upon the plan that you choose. If you choose a plan that has no premium, because all of the plans start at zero, if you choose a plan that has no premium, you would only be paying that $148.50 and whatever your co-pays are, and you wouldn't be paying anything else. If you choose a plan that has a premium, it would be $148.50 plus whatever premium you chose. Okay? And I think that's everybody, so let's go ahead and move on. Okay. So this is basically what your Medicare card is going to look like. That's why they call it the red, white, and blue card. And both of these parts will be, you'll see Hospital Part A and Medical Part B on your card when you receive it. Okay. This slide is basically just to give you an idea of what it's going to look like. So let's go ahead and move on. Okay. So here are those numbers. I'll start with Hospital Part A. So these numbers are all if you have original Medicare only. Okay, this is not information with a Medicare Advantage or a Medicare Supplement plan. This is what you would be paying if you had nothing else. Okay? If you had nothing else but that red, white, and blue card, you would be paying a $1,400 deductible for your inpatient hospital for days 1 through 60. Okay, and that's only for the hospital room stay. After day 61, you are going to pay $371 per day. And then after day 90, you are going to pay $742 per day. If you are in a skilled nursing facility, which a skilled nursing facility is not a nursing home, although nursing home care does fall under Medicare Part A, that's not what they're talking about here. A skilled nursing facility does not cost you anything for days 1 through 20. After day 20, you are going to pay $185.50 per day, and then after day 101, you are responsible for all of your costs. Okay? Now, Medicare Part B, which is your medical insurance. So say you're in the hospital and your hospital deductible is that $1,400.84 premium. But guess what? You're not just sitting in a hospital. You're being treated by doctors while you're in the hospital. You're getting diagnostic. You're getting testing done while you're in the hospital. So that is going to fall under your Part B. And under Part B, like I said, the monthly premium is $148.50 for most. Okay. And then you've got a yearly deductible of $203, okay, that you have to pay. After you pay that $203 deductible, guess what? You are now responsible for 20% of your medical costs. And that's why most people go into a Medicare Advantage plan, is because that 20% could be 20% of $100, which isn't going to hurt most people, or it could be 20% of $200,000, which if you have an extended hospital stay, you're going to hit that number pretty quickly. And if you're responsible for 20% of $200,000 or more, and I'm just saying $200,000 because that's just an example. That number means nothing except for an example in this webinar. So that 20% is what you are responsible for. Okay. Now, I don't see any questions about this, so let's go ahead and move on. And here is where I'm going to hand it over to Sarah to kind of wrap it up, and not wrap it up, but kind of run us through the final portion of this webinar. And real quick, I just see a question from Ken. Is there an out-of-pocket maximum for Part B? Ken, no, there is not. Not if you are on original Medicare alone. And that's why, and Sarah's going to get into more detail on this, that's why it's important to have something else besides original Medicare, because the sky's the limit if you're on original Medicare. And that's why that 20% number is so scary to a lot of people, because like I said, it's 20% of anything. Okay, and now I'm going to hand it off to my associate, my compatriot, Sarah Wallace, to answer the remaining portion of your questions.
Hi guys, how you doing? Ken, you set me up, you set me right up great to start off. There is no out-of-pocket maximum, and that is alarming, right? So that is why, we have this option afterwards, why most people don't stick with original Medicare, just those parts A and B. They want that covered. I mean, I would. So that's what the rest of this presentation is going to be about, how we cover that. I do want to quickly say, my faculty let me know that we are actually going to have a quick fire alarm test. So if you hear me go dead silent at all during the presentation, just know that I've put myself on a quick mute so you don't get to hear the very loud alarm, and I will be back. But I just wanted to give you guys a heads up because unfortunately we can't reschedule it. So this choice, right, to cover that 20%, Diana, I'm just reading your question now. Is there other private insurance that covers the 20%? Let's get into the slides a little bit, because yes, it depends on your situation, but either Medicare Part C or your Medigap would be covering it. So that's what these two options are on our screen. Are we going to go with that Part C with that Part D included, or are we going to do a Medigap with Part D drug coverage? So what is the difference, and how do you choose which path to go down in order, to cover that risk. That's a substantial financial risk, right? And it's all a mindset. It's really a personal decision and about your lifestyle. Would you rather pay up front and pay nothing at the time of an event, or are you more comfortable, paying nothing for now and then having to pay at the event? So let's go into that. Our first option is the Medigap supplement. So you'll also hear these called Medicare supplement plans. So Medigap and Medicare supplements are the same thing. There are no networks in the Medigap plan. In New York State, we have guaranteed renewability as long as the premium is paid, and your benefits never really change. It behaves like a true insurance policy. Your plans are comprehensive. You have really no out-of-pocket healthcare related expenses at the time of the event. So if you're someone who likes to travel or someone who's not in New York all the time, you would want to give this Medigap plan a look, right? The other option is your Part C Medicare Advantage, and this is offered by private insurance companies, Diane. So this is one of the ways to cover that 20%. These plans must cover everything that Part A and B cover except for hospice. And there's usually additional benefits such as vision, dental, hearing. Not every plan has those, so it's important to go over your multiple options depending on what's important to you. And there's also sometimes gym memberships included. These plans, the Part C, most closely resemble the health coverage you had while you were working. You'll pay co-pays, and the more significant your health situation, the more likely you'll have to pay a higher copay at the time of an incident, right? So it's you compare these. You have the Medigap, you have zero to low out-of-pocket expenses when used, but that means you're going to pay more month to month versus your Part C, where you typically have lower monthly premiums, but at the time of the event, you will have those higher co-insurance amounts. Any questions on, the differences between Medigap and Part C and why you would pick one over the other? Wait, I don't see anything. You can always shoot the questions as they come up into the chat. So the Medigap versus Part C, again, that's something that you want to talk to someone about to make sure you're making the right decision for you, right? It's intimidating. Which one am I going to choose this year? Which one really fits me? And not only is there Medigap and then Part C, but then every single carrier has different plans too that you have to compare. So this is where, that Medicare expert can really help you narrow down your decisions to the best plans available to you. Moving off of the 20% coverage, we're going to talk about prescription drugs, right? So this is where formularies come in. This is a huge risk if you don't understand how your carriers price their drugs or what they pay for their drugs. So across the board, every carrier is going to put their prescription into tiers. That doesn't mean your prescription is going to be in the same tier, carrier versus carrier, but everything will be tiered. So I want you to understand what these tiers are. When you hear them in the future, you can kind of understand what you're comparing. So from 1 to 5, it goes preferred, generics, all the way to specialty. And as you can see right there on the screen, it starts out with $1 sign, but then it gets expensive quick. This is really an important place to understand, what carriers pay, because it's going to affect your coverage. So your drug coverage costs reset at the January of each year. So every year it's going to reset you to your initial coverage period. You're going to pay your copays, and your plan is going to pay the remaining cost of your total drugs until that amount reaches $4,130. Once you reach that $4,130, you're going to be in your coverage gap, where you're going to be responsible for 25% of brand name and generic drug costs. So we really want to compare and contrast the price of each drug carrier over carrier to kind of either, keep you out of that coverage gap if we can. Elizabeth, you have a great example where there was a common drug that was covered by one carrier and it wasn't covered by another one, and it was going to cost our client substantial amount of money. Can you go into that?
Yeah, this actually happened very recently. As recently as, well, actually, I ended up enrolling her yesterday. So there we go. So I had a member come in. She wanted to talk to me about her plans, and she was specifically looking at one carrier and their $0 plan that she just really, was attractive to her. She thought it was going to be a good fit. Um, Turned out one of her medications was not going to be covered at all, so she was going to have to pay out of pocket for that. And not only that, but the retail cost of her medications for her other drugs was going to be pretty high. So she was going to hit that gap really, really soon, and she wasn't going to get out of it. So what we did was we took a look at another carrier, and not only did that carrier cover her medication that the previous one did not, it covered her medication. The retail cost on that medication was a third of what the other carrier was going to charge her, and then all of her other retail costs were significantly lower. So with the first carrier, we were looking at $2,400 a year in prescription drug costs. And when we looked at the other one, we were looking at $700 per year in prescription drug costs. So the carrier that you go to, and like I said way back in the beginning, just because a plan might look attractive to you, it might look like it's a really good option. Once you get down into the formularies, once you get down into the nitty gritty, so to speak, you could be looking at significant costs for that very attractive $0 plan. So you really want to take the time to take a look at it and make sure that you're going to get the coverage that you need, and not just, look at a $0 option.
Another point I want to make, guys, is if your prescription drug coverage is currently covered on your employer coverage, say with one of the carriers, that doesn't mean it's going to be covered once you move to Medicare. So it's important to be able to, identify where each of your prescriptions lie in each of the carriers. And that's where me and Elizabeth really dig down and do our homework for you to make sure we're bringing you the best possible plans for your prescription drugs, right? And this is where, your neighbor might be on what they think is the best plans, but they're not on the same drugs as you. Your costs are going to be different. So it's important to be able to identify, where we can save you money year over year and make sure you're fully covered. We want to keep you out of the coverage gap if we can. Um, However, it's not possible for everyone. Some people do have higher prescription drug costs. David, I'm going to answer your question first. Are there family plans? That is a wonderful question. Each Medicare journey is your own. So it is not at all like when you can be on your spouse's or partner's healthcare plan. You have to have your own Part A and B and your own either Medigap or Part C coverage. So you can be on the same type of plan, but you are going to be enrolled separately. Elizabeth, do you mind if you answer Debbie while I take a quick drink?
Yeah, absolutely. So Debbie, your question is the NY Empire plan is very prevalent. Does that have the same gap hole when it comes to, okay. So if you're asking about the New York Empire plan, I'm going to guess that you or your spouse are a state employee and you're going to be going on night shift, which I'm very, very happy you asked this question because if you have or you are going to have the Empire plan or NISHIP or any sort of FEP plan, which is a federal employee plan, if that is your situation, this webinar and what Sarah and I can do for you is not going to be helpful to you at all, because state employees, federal employees, if you're on Empire or NISHIP or FEP, if any of those words sound familiar to you, as in that's what you have now, we cannot help you. You will have to go to your benefits administrator or your HR representative and talk to them about what you need to do and what your plan options are going to be, because you fall outside of this realm. You're going to fall into a different category, and you're going to have different and better benefits than most people have. Same with your spouse. Your spouse is going to be given options about what they can do and what they're going to have. Most likely, they are going to enroll you in Medicare Part B, but neither Sarah nor myself can answer all of your questions about Empire or NISHIP. So if that's the case for you, Debbie, or anybody else on this call, just go ahead and make an appointment with your benefits representative or your HR person and talk to them, because that's the end of what we can help you with. And I'll turn it back over to Sarah here. Sorry, Sarah, for butting in, but here you go.
No, it was perfect timing. The alarm went off, so I'm kind of glad it worked out well. So as you can tell, prescription drug costs and each carrier's formularies, are one of the common potholes. The other one is your networks. Are you married to your provider? I've been going to the same healthcare provider since I was in diapers. I always want to go with them. So for me, it'll be important, that my Medicare covers my physician. So those are the type of things that we want you to bring to your appointments with us, so we can help you find what covers you where you are. Yes, Lori, yep. Not every single plan, but Medigap and Medicare Advantage plans do sometimes have additional premiums. It does depend on which plan you sign up for, and we can go in detail in a more private setting. Guys, one thing I really want you to think about, especially this year, especially after 2020, your health situation today might not even be the same as it is next week. Here's where I bring the doom and gloom, and I'm sorry for it, but I need you to think this way, because I don't want anyone to find themselves at, substantial financial hardship because of the pandemic, because their health situation changed. God forbid you guys get cancer. The last thing you want to think about during that health crisis is, am I limited to in-network faculties? Am I going to be able to go to Roswell? Am I going to have to pay an arm and a leg for my prescriptions? We want to be able to make sure we find you the best access for your situation, right? So what are the next steps here? The important questions to ask yourselves are you signed up for Part A, or when can you sign up for Part A? When is that initial enrollment period for you? If you are signed up for Part A, what is your, Part B plan, right? Once you know what you are going to do with Part A, if you have questions about when to take Part B, make an appointment with us. Those direct lines right there on your screen, those ring right to our phone. Those are our emails if that's your preferred contact. We're here to help you answer any questions you might have on this government created healthcare, right? Everyone knows that they don't exactly make things easy on you. So me and Elizabeth are here to make it, less stressful.
And I just want to say I really appreciate everybody who attended today. I hope this was helpful. I hope that everybody leaves here with a better feeling about their understanding, and if there's anything we can do to help answer further questions, if like we've said throughout, everybody's situation is different. You're going to have a different health situation than even, your spouse or anybody else. So you need to understand what's going to apply to you and what's going to be the best option for you, because the best option for you is not the best option for somebody else. So reach out to us, make that appointment, set up a time to talk to us. It's completely free, and it takes a few moments or an hour at the most to help answer everything for you. Oh, and I see Lori had a question here. How does Medicare figure in if you remain employed full-time at 65? Lori, if you are going to be working past your 65th birthday and your your employer has more than 20 employees, you can put off Part B until you're going to be retiring. So you don't have to do anything right away. You do have that option to put it off, but you will need to know when you're going to be retiring so you can make plans around that. Okay, so I think we've reached the end. Sarah, do you have anything else you want to add?
No, I really appreciate it.
Yeah, absolutely. Thank you so much, everybody. I told you we were going to get you out of here before 11. Go enjoy the rest of this kind of gloomy day and reach out to us if you have anything else.
Thank you all. Bye now.